Which of the following is a very long acting beta 2 selective agonist that is used for asthma prophylaxis? 130 D salmeterol. ठीक है। The following drug is contraindicated in bronchial asthma. Bronchial asthma में contraindicated भाई कौन है? Propranolol. ठीक है। Which of the following drug used for the treatment of bronchial asthma are bronchodilator except होची 132 A, that is called to beclomethasone. Beclomethasone. Following statement are true about theophylline except 133B, that is called to it stimulate adenosine receptor in bronchi. Advantages of salmeterol over salbutamol is its 134, that is called to C, longer duration of action. Therapeutic blood range of theophylline in microgram per milliliter is okay छोड़ो। थियोफाइलिन ओवरडोज कॉजेस क्या कॉज करेगा? 135 B सीजर। Therapeutic blood range of theophylline in microgram per milliliter is 136 होची तमरा D, that is called to 5 to 20. In theophylline metabolism, drug interaction occur with all except. In theophylline metabolism, drug interaction occur with all except किसके साथ नहीं होता है? 137D, that is called to टेट्रासाइक्लिन के साथ नहीं होता है, बट किसके साथ होता है? सिमिटिडिन के साथ होता है, रिफाम्पिसिन के साथ होता है, फेनोबार्बिटन के साथ होता है। All of the following statement about the use of glucocorticoids in asthma is true except होची 138 होची तमरा D, that is called to they are bronchodilator। ठीक है 138 D। Which of the following non-opioid is an antitussive agent? Which of the following non-opioid is an antitussive agent? 139 हेगला तमरा A, that is called to clofedianol. Which of the following non-opioid is an antitussive agent? Clofedianol. The common and dose-related side effect of salbutamol is 140 हेगला तमरा B, that is called to muscle tremor। ठीक है। Select the most appropriate drug for the regular prophylactic therapy in a 10-year-old child who suffer from exercise induced asthma 141C, that is called to inhaled sodium chromoglycate। The most prominent and dose related side effect of salbutamol is, that is called to muscle tremor। Efficacy of salmeterol is increased if it is given along with I think 143 no corticosteroid 143B। okay। Relatively higher dose of theophylline is required to attain therapeutic plasma concentration in 144A, that is called to smokers। Which of the following is a long-acting beta 2 agonist? 145 ये वाला है salmeterol। The most consistent, pronounced and sustained relief of symptom in chronic bronchial asthma is afforded by 146 ये वाला हमारा D corticosteroid। Omalizumab is used for 147 147 ये गला तमरा B, that is called to asthma. In patient of bronchial asthma, inhaled corticosteroid achieve the following except. In patient of bronchial asthma, inhaled corticosteroid achieve the following except 148 B, that is called to control an attack of refractory asthma. Control an attack of refractory asthma. Leukotriene antagonists are used in bronchial asthma. 149. 149 which is C. Add adjuvant to beta 2 agonist for avoiding corticosteroid. In patient with bronchial asthma, inhaled corticosteroid achieve the following except 150. 150 ହେଲା ତମର B, control an attack of refractory asthma. Potassium iodide is secreted from the bronchial gland and can dash airway mucosa. Potassium iodide is secreted from bronchial gland and can क्या कर सकता है, इरिटेट कर सकता है mucosal airways को. Which of the following is useful in AC severe asthma? A by C. 152. MgSO4. A 55-year-old female who is taking propranolol for management of cardiovascular disease experience an acute attack of asthma. Which of the following drug would you prescribe to attenuate this attack? 153. 153 D. Ipratropium bromide. Which of the following is not true about Borg-Strauss syndrome? 154. A common inflammatory reaction observed after treatment with leukotriene pathway modifier. Inhaled beclomethasone dipropionate. Inhaled beclomethasone dipropionate should be used only in moderate to severe chronic asthma. One of the most common side effects of inhaled beclomethasone dipropionate is 156. 156 है B, that is called to oropharyngeal candidiasis. Reflex bronchoconstriction is most likely to occur with the following form of inhaled anti-asthma medication. 157, that is called to B, dry powder Rotacap. Choose the correct statement about the inhaled glucocorticoids in chronic obstructive pulmonary disease. 158. A, they are indicated in coughed only for severe advanced cases. To be a useful inhaled glucocorticoids, the drug should have to be a useful inhaled glucocorticoid, the drug should have 159 B, low oral bioavailability. A patient of chronic bronchial asthma was maintained on oral prednisolone 20 mg per day for 3 months. It was decided to switch him over to inhale beclomethasone dipropionate 200 microgram 4 times a day. What should be done to the oral prednisolone medication after starting inhaled beclomethasone? 160. It should be given at the same dose for 1 week and then tapered. The following component of a management protocol of status asthmaticus has now been shown to be useless. The following component of a management protocol of status asthmaticus has now been shown to be useless. 161. A. Intravenous aminophylline. In bronchial asthma, the mechanism of action of a corticosteroid is 162 ये गला तुम्हारा डी इनिबिट lymphocytic eosinophilic mucosal inflammation. Which of the following is not an adverse effect of salbutamol? Which of the following is not an adverse effect of salbutamol? इनमें से salbutamol का adverse effect कौन नहीं है? 163 D. That is called to hypoglycemia. Okay. Inhibition of a 5 lipoxygenase is useful in 164. Yes. Bronchial asthma. The drug not used in acute asthma is acute asthma. No. Montelukast. Inflammation in the airways can be reduced by 166. B. Budesonide. Inflammation in the airways can be reduced by budesonide. Which of the following anti-asthma drug is not a bronchodilator? Bronchodilator कौन नहीं है? 167. Yes, correct. Sodium chromoglycate. Which is a soft steroid used in bronchial asthma? Which is a soft steroid used in bronchial asthma? Which is a soft steroid used in bronchial asthma? Which is a soft steroid used in bronchial asthma? 168. C. Cyclesonide. 168. Omalizumab is administered in bronchial asthma by which route? 169. C. Subcutaneous route. Which of the following does not have a role in acute attack of asthma? Which of the following does not have a role in acute attack of asthma? Yes, correct. Choose the correct statement about Bambuterol. Bambuterol के लिए correct statement कौन हो जाएगा? 171. Yes, correct. It is an oral acting bronchodilator. It is a prodrug. It inhibits enzyme pseudocholinesterase. Which among these are long-term medication used in asthma? I think D. Is correct. Inhaled corticosteroid Zafirlukast, Montelukast अस्थमा के केस में. All of the following are employed in inhalation therapy of asthma except 173. C. Dexamethasone. All of the following are employed in the inhalational therapy of asthma except dexamethasone. Which xanthine derivative has no function in asthma? Which xanthine derivative? इनमें से कौन सा xanthine derivative अस्थमा में इसका कोई काम ही नहीं है? 174. B. Pentoxifylline. Which of the following drug can be administered by subcutaneous route? Which of the following drug can be administered by subcutaneous route? 175 ये वाला तुम्हारा B, that is called to terbutaline. 175B. The loading dose of aminophylline is aminophylline का loading dose क्या होता है? 176. D. 5 to 6 mg per kg. Which of the following does not have sulfhydryl group? Which of the following does not have sulfhydryl group? Which of the following does not have sulfhydryl group? 177 होची A. Bromohexane. Which of the following drug decreases plasma half-life of theophylline? It 178. Phenobarbital. For bronchial asthma, all of the following drug can be given by inhalational except होची এটা 179. D. Prednisolone. Which of the following is a mast cell stabilizer? 180. Sodium chromoglycate. Which of the following is not used for the treatment of acute attack of bronchial asthma? Beclomethasone. All of the following are mast cell stabilizer except 182. B. Flunisolide. 182. Which one of the following drug is not a selective beta-2 adrenergic agonist? Which one of the following drug is not a selective beta-2 adrenergic agonist? 183. B. Ephedrine. Size of a particle for aerosol therapy is 184. A. 2 से लेकर के 5 parts per million. Theophylline level in blood are increased by theophylline level in blood are increased by theophylline level in blood are increased by D. 185. No. Cimetidine. Release of histamine and leukotriene from mast cell is prevented by 186. Nedochromyl sodium. Corticosteroid has which action in asthma? Corticosteroid has which action in asthma? 187. C. Inhibition of leukotriene synthesis. 187. C. Which of the following is a very effective in Rx of acute exacerbation of asthma and status asthmaticus? 188. D. Brother. Which drug used in bronchial asthma needs monitoring? Which drug used in bronchial asthma needs monitoring? 189. Theophylline. Which of the following anti-asthmatic drug is a leukotriene antagonist? Anti-asthmatic drug is a leukotriene antagonist. 190. B. Montelukast. The following drug is not useful in the treatment of a patient with acute severe bronchial asthma. 191. C. Montelukast. One of the following agents stimulate respiration by inducing metabolic acidosis. 192. C. Acetazolamide. All of the following are mucolytic except dextromethorphan. What are the main components of a pathophysiology of asthma? Correct. Using meter dose inhaler aerosol dose of dash cough is administered. 195. 100 microgram per puff is administered. 195. C. The most consistent, pronounced and sustained relief of symptom in chronic bronchial asthma is afforded by corticosteroid. Which of the following beta-2 agonist bronchodilator is given by inhalational and is suitable for both terminating asthma attack as well as for twice daily prophylaxis? 197. D. Formoterol. Following agent can safely be administered when etiology of asthma is doubt, cardiac or pulmonary. Following agent can safely be administered when etiology of asthma is in doubt, cardiac or pulmonary. क्या होगा? 198. Aminophylline. The following statement about disodium chromoglycate is incorrect. The following statement about disodium chromoglycate is incorrect. Incorrect है. 199. C. It is not useful in exercise induced asthma. All of the following are used as inhalational device in asthma. All of the following are used as inhalational device in asthma except correct vaporizers. तापर drug acting on hormonal system, respiratory सल्ला hormonal केतेटा अछि श्रीमाता श्री महाराज की। श्रीमत् सिंहासनेश्वरी चिदग्निकुंड संभूता देवकार्य समुद्यता उद्यत भानु सहस्राभा चतुर्बाहु समभूमिता रागस्वरूप पाषाढ्या क्रोधकाराङ्कुशोज्ज्वला मनोरूपेक्षुकोदण्डा पञ्चतन्मात्रसायका निजारुणप्रभापूरा मज्जतब्रह्माण्डमण्डला चम्पकाशुकपुन्नागा सौगन्धिकालसत्कचा गुरुविन्दमणिश्रेणी कनत्कोटिरमण्डिता अष्टमी चन्द्रबिभ्राज दलितस्थलशोभिता मुखचन्द्रकलङ्काभा मृगनाभिविषेका पतनस्मरमङ्गल्या गृहतोरणचिल्लिका भद्रलक्ष्मीपरिवाहा चलन्मीनाभलोचना नवचम्पकपुष्पाभा नासादण्डविराजिता ताराकान्तितिरस्कारी नासाभरणभासुरा कदम्बमञ्जरी क्लुप्ता कर्णापूरमनोहरा ताटङ्कयुगलीभूता तपनोदुपमण्डला पद्मरागशिलादर्शा परिभावैकपोलभो नवचम्पकमश्रीन्यक्कारिदशनच्छदा शुद्धविद्याङ्कुराकारा द्विजपङ्क्तिद्वयोज्ज्वला कर्पूरवीटिकामोदा समाकर्षेदिगन्तरा नीचसल्लापमाधुर्या विनिर्भर्षितकच्छपे मन्दस्मितप्रभापूरा जय मां ललिता महात्रिपुरसुंदरी। Drug acting on hormonal system. Which of the following is not an endocrine gland? इनमें से endocrine gland कौन नहीं है? Salivary gland, pituitary gland, pancreas gland, parathyroid gland, all are endocrine gland. The secretion from which of these gland differs between male and female? C. Gonadal. Who is known as the father of endocrinology? Thomas Edison. Who is known as the father of endocrinology? Thomas Edison. Endocrine gland differ from exocrine gland in that for endocrine gland are ductless and exocrine gland release secretion at the body's surface or into ducts. The endocrine gland responsible for body circadian rhythm is the endocrine gland responsible for body's circadian rhythm is the B. Pineal gland. Which gland control basal metabolic rate? Which gland control basal metabolic rate? BMR. 6. Thyroid. What will happen if insulin alone is given rapidly in diabetic ketoacidosis? 7. Hypokalemia. Which of these is not an endocrine property? Rapid acting effect. Name the gland that is located at the base of the throat, just inferior to the laryngeal prominence. Adam apple. No number D. Thyroid. Insulin causes all of the following except thus D. Ketogenesis. Which of these is true for endocrine system? 11. All of the above are true. Secretes hormones that are transported to the target cell by blood, causes changes in metabolic activities, effects are prolonged. Which gland is located just superior to the kidney? Adrenal. The primary target of releasing and inhibiting hormone of the hypothalamus is the primary target of the releasing and inhibiting hormone of the hypothalamus is the anterior pituitary. Most hormone of endocrine system are regulated by, I think 1A hour. Yes, correct. Negative feedback mechanism. Which is not a function of the hypothalamus. Hypothalamus का function इनमें से क्या नहीं है? Control temperature अरे चलेगा. Affect water balance, affect heart rate, okay चलेगा. I think D. Yes, correct. Which of these hormone is made by posterior pituitary? Posterior pituitary द्वारा कौन सा हार्मोन ये होता है? Posterior pituitary. A. No. ADH, antidiuretic hormone. How do hormone from the thyroid and parathyroid regulate the calcium concentration of the blood? 17 होची तमरा A. That is called to calcitonin lower blood calcium. Parathyroid hormone raises blood calcium. Calcitonin lowers blood calcium. Parathyroid hormone raises क्या करेगा? Blood calcium. The posterior pituitary stores and release. क्या स्टोर करता है, क्या रिलीज करता है? posterior pituitary. 18. C. Oxytocin and antidiuretic हार्मोन. पोस्टेरियर पिट्यूटरी स्टोर करेगा ऑक्सीटोसिन, रिलीज क्या करेगा, एंटी डायरेटिक हार्मोन. विच ऑफ द फॉलोइंग हार्मोन आर रेस्पॉन्सिबल फॉर द फाइट और फ्लाइट रेस्पॉन्स. अरे एपिनेफ्रिन, नॉन एपिनेफ्रिन पूरा जग जानता है. The pituitary hormone that stimulate the male testes to produce sperm and stimulate the development of the follicle in the female on a monthly cycle is follicle stimulating hormone SIRE. Okay, correct. Which hormone of adrenal gland supplement the sex hormone from the gonads? A haba. No. Gonadocorticoids such as androgen. Okay. The cluster of cells in the pancreas that produce hormone are the 22 hela तमोरा B. Islet of Langerhans. The glucagon is a glucagon क्या होता है 23. Okay. Accelerate the conversion of glycogen into glucose. Calcitonin is a hormone of which of the following? Calcitonin is a hormone of which of the following? 24 B. Thyroid gland. Calcitonin is a hormone of which of the following? The most common cause of hypothyroidism in underprivileged countries is 25. A. Iodine deficiency. All of the following are hormone of the anterior pituitary except 26. C. Parathyroid hormone. This property of a hormone causes it to not display its complete effect without the presence of another hormone. This property of a hormone causes it to not display its complete effect without the presence of another hormone. 27 ହେଲା ତମର C. Permissiveness. On the cell, where is the hormone response element found? On the cell, where is the hormone response element found? 28 B. DNA. This is a neuroendocrine organ. इनमें से neuroendocrine organ कौन है? This is a neuroendocrine organ. 29 B. Hypothalamus. Which of these does the chemical classification of a hormone exclude? Which of these does the chemical classification of a hormone exclude? 30 ହେଲା ତମର C. That is called to glucose containing hormone. Which hormone takes up the role of a transcription of a new messenger RNA? 31 A. That is called to steroid hormone. The sympathetic nerve stimuli release. The sympathetic nerve stimuli releases क्या रिलीज करता है? 32 B. That is called to epinephrine रिलीज करता है. This system has a capability to directly override the normal endocrine control. 33 B. Nervous. Secretion of parathyroid hormone is a good example of 34 A. Humoral stimuli. 34 This is the shortest in water soluble hormone. This is the shortest in water soluble hormone. 35 Applied. This is not a major endocrine structure, however, produces hormone along with performing its main function. 36. Kidney. Hormonal receptor. हे भगवान. Hormonal receptor. Fastest receptor mediated action is through fastest receptor mediated action is through 37. B. Intrinsic ion channel. Receptor with slowest mechanism of action. Ion channel first of nuclear enzyme membrane. I think D. 88. Yes, correct. Mineralocorticoid receptor are present in all except 39. No, 11. Which one of these following statement best describe the mechanism of action of insulin on target cell? 40. 40 है tomorrow. C. That is called to insulin bind to a transmembrane receptor at the outer surface of plasma membrane which activate the tyrosine kinase, that is the cytosolic domain of the receptor. Which of the following act on nuclear receptor? 41. C. Estrogen. Which of the following act on the nuclear receptor? Estrogen. Steroid act by which receptor? Steroid act by which receptor? 42. Intracytoplasmic. All of the following have a receptor which are transcription factor except A. 43. A. Insulin. All of the following belong to the steroid receptor superfamily except C. Epinephrine receptor. Receptor for which the following is present intracellularly. 45. B. Corticosteroid. All of these hormone use CMP as a second messenger. All of these hormone use CMP as a second messenger except 46. D. That is called to vasopressin. Insulin act by stimulation of 47 है B. That is called to enzymatic receptor. ठीक है. Target organ of growth hormone is target organ of growth hormone is 48. A. Liver. In hyperthyroidism, value of following will be lower than normal. 49. D. Thyrotropic hormone. Following is an example of antithyroid iodinated contrast media. 50. B. That is called to ipodate. Thyroid enlargement without excessive thyroid hormone production is, that is called to 51. A. Non-toxic goiter. Degradation of insulin occurs primarily in kidney, liver, muscle. Maturity onset diabetes involve glucokinase gene mutation is 53. MODY2 Following is a intermediate acting insulin preparation. Following is intermediate acting insulin preparation. 54. A. NPH. Following is a factor which determine the rate of absorption of insulin after subcutaneous administration. So, 55. D. All of them. Site of injection, subcutaneous blood flow, regional muscle activity at the site of injection. बापरे बाप. Anterior pituitary hormone. Release of anterior pituitary hormone is regulated by the hormone secreted from the hypothalamus. Which of the following hormone is not released from the hypothalamus? 56. Growth hormone, releasing hormone. Propionmelanocortin is a precursor for the following peptide except 57. B. Thyroid stimulating hormone. Metabolic action of a growth hormone include the following except 58. A. Increased glucose uptake into the cell. Which of the following condition do not manifest as short stature? 59. D. Hypersecretion of growth hormone, releasing hormone. The condition associated with the onset of hypersecretion of growth hormone in adult is known as acromegaly. A 50-year-old man has a puffy skin and is lethargic. His plasma TSH level is low and increased markedly when he is given thyrotropin releasing hormone. What is the likely cause? 61. Hyperthyroidism due to an abnormalities. Which of the following increases the secretion of a growth hormone? 62. C. Hypoglycemia. The antidiuretic hormone originate primarily in the supraoptic nuclei of the hypothalamus. Which of the following statement is false regarding ADH? 63. D. That is called ADH increases water reabsorption in the proximal tubule. Oxytocin originate primarily in the paraventricular nuclei of the hypothalamus. Which of the following statement is false regarding oxytocin? 64. D. None of the above. Prolactin is structurally homologous to growth hormone and is responsible for lactogenosis. Which of the following factor increases prolactin secretion? 65. Dopamine. Octreotide is used for, that is called to 66. A. Acromegaly. What is Sisson's syndrome? 67. The pituitary adenoma is hemorrhagic and necrotic. 67. Cabergoline is used in 68. C. दो तीन भी acromegaly, hyperprolactinemia. Which of the following hormone is produced by pituitary gland in both male and female but functional only in a female? 69, 69, 69. B. That is called to prolactin. Which of the following is an accumulation and releasing center of a neurohormone? Which of the following is an accumulation and releasing center of a neurohormone? 70. C. Posterior pituitary gland. MSH is produced by 71. D. Pars intermedia of pituitary. Sertoli cells are regulated by pituitary hormone known as Sertoli cells are regulated by pituitary hormone known as 72A FSH. Trophic hormone are formed by 73A anterior pituitary. Giantism and acromegaly are due to 74. The hyperpituitarism. What is 74 B? Okay. What is Warmer syndrome known as? Warmer syndrome also known as 75 men type 1. Which hormone causes contraction of labor? 76D. Oxytocin. Which of the following is not released by anterior pituitary gland? Which of the following is not released by anterior pituitary gland? 77. 77. B. That is called to TSH. Which of the following is not released by anterior pituitary gland? Which of the following is not released by anterior pituitary gland? 77. 77. 77 of B. ADH. What is Carne complex? What is Carne complex? 78. C. Autosomal dominant disorder. What is the treatment of a GH coma? What is the treatment of a GH coma? 79. 79 is B. Somatostatin analog. The release of the following hormone is inhibited by somatostatin except cortisol. Which of the following statement regarding bromocriptine is false? 81. C. It is a potent oxytocin agent. All of the following are used of oral B GnRH agonist except 82. D. An ovulatory infertility. 82 D. Growth hormone and related drug. Which of the following are side effect of a growth hormone administration? 83. D. All of the above. Pain at the injection site, glucose intolerance, hypothyroidism. Function of a growth hormone include the following except 84. B. Anti 84. anti-lipolytic. Nasally acting GnRH analog is 85. Nasally acting GnRH analog is 85. C. Nafarelin. Nafarelin. Route of administration of a GnRH analog. Route of administration of a GnRH analog 86. A. Subcutaneous 86A. Following is true about GnRH agonist except G 87T. Ganirelix is the most potent agent. Drug used for medical management of acromegaly due to a small pituitary tumor is Pegvisomna Suman Pegvisomsuman Pegvisomsuman is used in 89 acromegaly. All are true for octreotide except 90 used orally.